when you delegate employee health and well-being down deep into an organization and treat it as a fixed cost, you're implicitly making the comment that it has little to do with the company's overall performance. And going back to my analogy about athletes, no one would believe that if an athlete is in subpar health, that has nothing to do with the team's performance. So there's nothing is different with employees. Every employee matters, and health and well-being of every employee matters, particularly in organizations that are leaner today than they've ever been. So this is a myth that needs to be exploded. I do want to make one more comment about the cost of healthcare, and you're seeing it here, that it shows up in so many different places that you need a holistic understanding of the cost of poor health. So I'll ask Ray, who has done some very significant research on the relationship between culture of health and organizational performance.
Yeah, thanks, Mike. I do enjoy sharing with the audience the research that I've done over a number of years now, and I've actually published with others 9 articles that compare the organizational performance to the degree to which an organization is committed to building cultures of health and well-being. And some of you may know of the most recent article that I've written that shows clearly that companies that distinguish themselves in building cultures of health, safety, and well-being outperform the stock market. I think the point that Mike's making also around this concept of connecting what we're talking about to sports teams may be best expressed by a program that emanated out of General Electric even before I served as their global medical leader. The program was called the Industrial Athlete, and we really focused on our workforce as if they were athletes, and we were trying very hard to do whatever we could to prevent injuries, to make the workforce healthy, and to get the workforce back to work whenever they were ill, in the same spirit of professional sports teams.
Great. Mark, do you want to comment on this one? I think.
Yeah, I mean, obviously, obviously there's this sort of overall sort of stock market performance, which I think Ray is sort of, with his work, has definitely proven that sort of companies that have a good culture of health actually perform better on the stock market. A lot of companies also sort of measure their performance against sort of workplace accidents and injuries. And certainly other studies have shown that sort of healthier employees have fewer accidents, and when they do have accidents, they recover quicker. And so that sort of has an impact certainly on direct costs in terms of sort of medical care, but also in indirect costs in terms of sort of absenteeism and sort of workers' compensation and other insurance costs. So, but one of the things I think that's really starting to really take hold is mental health here. Mental health is an increasing problem. We know there's challenges in getting access to care. But mental health really drives both presenteeism, absenteeism, and poor performance as it impacts. But it's impacting sort of at any one time probably a third of your workforce. So it's something that really needs to be addressed. That without addressing it, it's going to be a significant drain on the organization. And certainly as we're coming out of COVID, there's all that additional stress and anxiety that's been put on people. And it's not just the employees, but it's also worrying about family members and children and parents, etc., that can really impact it going forward.
Yeah, I think you need to take the same approach to mental health that I talked about earlier in terms of population health. And in the mental health side, they talk about helping people continue to thrive versus on the other side of the coin, trying to identify people who are either at risk or who have an acute behavioral health issue, as well as helping those people that carry a chronic mental health diagnosis, or sadly, those that are truly struggling or even perhaps suicidal. So best practice employers are attending to all 5 of those pillars on the mental health side as well.